Hi everyone, so this is my assignment for the health behavior theory and behavior change. My name is Daniela Duarte. I'm a registered dental hygienist here in Texas. I graduated back in 2020 from Texas A&M. I have been practicing at a pediatric office in Arlington for the last 3.5 years, and I absolutely love my job. So for my assignment, the learning objectives are going to be the health issue is going to be gingival disease. The theory that I'm going to use is the health belief model. And lastly, the conclusion will just be a follow up of the patient I am going to present for this assignment. So, the health belief model, we know that it's a concept where the person has certain beliefs about the perceptions about contracting a illness or a disease, and those perceptions that the individual has allows them to engage in health promotions. And the constructs of the health belief model are going to be the perceived seriousness, the accessibility, the benefits, the barriers, and the cues to action, and as well as self efficacy. So, all of these are necessary for the health belief model to engage well. So, just a little bit background of what gum disease is. So, it's just the infection of tissues and surrounding structures of the teeth. So, this is going to include your gums, your bones, the ligaments around the tissue that hold the tooth together. It's caused by plaque, and all that plaque just causes irritation to the gingival tissue. And the risk factors for this are going to be poor oral hygiene, crooked teeth, genetics. These are just predispositions. And then for the signs that for gum disease is going to be bleeding gums, inflamed gums, and then bad breath. These are just a few of the most common signs and symptoms. So for my presentation, I used a work-related patient. So for my application for the health belief model, so for the patient, I'm not going to name him. I'm just going to name him Johnny. He is 15 years old. Just a little background on his information. He actually came to the office back in October 2023, but before that, he had not been into the office since 2021. So it had been a while before he had been coming. He was not coming to his regular recall appointments. So upon assessing the patient, he did have fair to poor oral hygiene. As you can see in the picture, I actually took a picture of his teeth. You can see the plaque just sitting on top of his canines. That's just accumulation of plaque that indicates to me that brushing has not been something that he does on a regular basis. He did report only brushing one time a day, no flossing. He also did state that he did brush only when he remembered. So upon doing a periodontal exam, this is where we just use an instrument to measure the gum tissue. He did have 4 millimeter pockets, which that means that his gums were inflamed and irritated. When doing this assessment, we like to see measurements from 1 to 3. And when doing this, he did have what we call bleeding on probing. So his gums were bleeding and irritated. So it did indicate that he did have gingivitis, which is just the inflammation of the gums. So during the appointment, I did do my assessment. So I did provide the patient with oral hygiene instructions as to how to brush properly, how to floss. I did educate the patient on gingival disease and the current status that he was at. The dentist also prescribed a mouth rinse that is called Paradix. This is an antimicrobial rinse that we often prescribe to patients who do have gingival disease, just to help aid in reducing the inflammation around the gums. And then we also did have the patient come back in 4 weeks, just to evaluate, just to make sure that the patient, his gingival tissue was doing well. So this is why we decided to have the patient come back for a reevaluation. So during the appointments, I do give my patients educational on the effects of periodontal disease. This is just one of the charts that I like to use when educating patients. It helps me give them a visual as to where they're at in their current state of oral health. So when showing this chart to Johnny, I did show him that based on what he presented with, plaque on his teeth, irritated gum tissue, bleeding, he was at a stage where his gums were inflamed, where he was at gingivitis, which, like we stated, is just the inflammation of the gums. So this is what I used to educate patients with in order to promote them into changing those habits and engaging in oral hygiene habits. So the application for the health belief model constructs that are beneficial for this patient were the perceived seriousness. So the patient was aware of his current oral health status. He did know that by not brushing 2 times a day or flossing on a regular basis did increase his chance of having gum disease or of it progressing. So here we have, it shows that he did have the perceived susceptibility of him having that disease. When talking to the patient, he did state of the benefits that could happen if he did engage in this behavior change, such as improved general health. So not only would his oral health improve, but health wise too as well. His confidence would increase. He wouldn't have so much plaque. And then, of course, that at the stage where he was at, it was reversible. The perceived barriers that he did state was just compliance, because he knows that, especially with flossing, of it being a daily thing. So those are the barriers that he stated for himself. So the goals that we both established as the healthcare provider and the patient were that he was going to be brushing 2 times a day, flossing at least 3 times a week, because we know that flossing is one of those things that many people do not enjoy doing every day. So we started off with at least doing it 3 times a week, and then as well as using the mouth rinse, the Paradix, the antimicrobial. He would be having to use it 2 times a day for 2 weeks. So, also one of the things that we do at the office is that we give the patients a report card where we highlight the areas that need improvement. So for Johnny, as we stated and we saw in the picture, that it was just mainly on those fronts of those teeth that we saw all the plaque sitting. So not only this, I told him, just put it on your restroom mirror or somewhere that you can see it like every day and serve as a motivation for you to continue brushing. So one of the things that he did state was that he did not like seeing all the yellow on his paper. So he did not want to see that anymore. So the cues to action for the patient was that he just did not want to see bleeding gums on anymore. So this prompted the patient to actually motivate himself into making a change in his oral habits. So, in conclusion, when the patient came back for his follow up appointment around a month or so, I was able to reassess the patient and see that there have been improvements in his oral hygiene habits. His gingival tissue improved greatly. He did not have any edema or erythema present. It was a nice pink color, is what we like to see. There was also reduction in his probings. So, due to him following on brushing and flossing and using the mouth rinse as prescribed, he no longer had 4 millimeter pockets, which was a good sign. His gums weren't bleeding anymore, and then the goal of self efficacy was accomplished because the patient was able to had the ability to undertake in the behavior and reached his desired outcome of engaging in good oral hygiene habits. So here we see that the health belief model did allow the patient to reach his goal of improving his oral hygiene, because he did state that he did not want for his gum disease or anything to progress or anything. So that was the good sign of the patient that we were able to engage in this theory and allow the patient to progress. So here we have the patient at his 4-week follow-up appointment. As you can see, the plaque, there's no plaque anymore. His gum tissue had resolved, no more bleeding on his gums. So the patient was able to understand the health belief model and incorporate it into his daily life which allowed for him to engage in health promotion, which allowed him to have good oral hygiene habits, which allowed him to just engage in good habits. So, one of the things that I always tell my patients is that they have to be willing to engage and participate in the behavior change, because we can never force them to do something, because if we force them, then it'll never get done, or they'll feel like it's too much. So, this is my presentation on the health belief model, and thank you, everyone. And here is the list of references that I use for my presentation for the health belief model, and then as well as for describing periodontal disease. Thank you, everyone.